Well, COVID-19 cases are surging in Arkansas. Hospitals nearing capacity, ICU beds almost at 100% in terms of occupancy. The state policy is basically, let's keep doing what we're doing. Dr. Joe Thompson, CEO of the Arkansas Center for Health Improvement, and I sat down to talk about where the pandemic is and where it's going. I see the statistics daily. They are not good at this point. They have not been good for a while. Put them in context for me over the last, say, week to 10 days. How much worse are we than X many days ago?
Roby, we've seen a dramatic escalation going from new cases in the hundreds to now new cases pushing 2,000 each day. This is a sign of broad spread. It's across the state. It's in all communities. I think importantly, we're seeing some of the highest concentrations of new COVID cases in the rural parts of our state that maybe haven't had the exposure, haven't had the threat, but now it's rapidly spreading in rural parts of our state. We've had two different hospital CEO groups. 2 weeks ago, Northeast Arkansas hospitals, this week, Northwest Arkansas hospitals, call for help from their communities. We see a dramatic increase in risk within the school district statewide. With the holidays approaching, I'm very concerned about the rate of spread and the number of new cases and unfortunately deaths that we're observing.
So you are clearly concerned about what's happening as we approach the Thanksgiving season here. What are a couple of things? I know you got a long list of things that people could do, but give me like a top three that you think would really make the situation at least not worsen.
Well, our board put out a prevention strategy that's on our website. We'll be glad to share with you about how to give thanks, but not COVID in 2 weeks. Thanksgiving is 2 weeks away. We're calling for all families to do several things. Hopefully, we can not have large gatherings with multiple household units coming together so that we don't have spread happen on Thanksgiving. But if folks are going to come together this weekend, have a conversation with everybody who's coming of how you're going to manage the risk. Starting this weekend, over the next 10 days, reduce your public exposure, less shopping, no restaurants, no bars, and then get a PCR test before you travel or the Monday of Thanksgiving week so that people who may be infected and asymptomatically spreading the disease don't sit down at the Thanksgiving table and infect your loved ones.
So at the tail end of this week, the governor said that there could be some difficult decisions ahead. What does that mean? Does that mean a mask mandate? Does that mean we go back to some sort of business lockdown? Does that mean schools have to go virtual? What do difficult decisions mean?
Well, he has a mask mandate in place now. Unfortunately, we are not compliant across the state in all areas, and that is the single most important thing to break the spread of this virus. I think as we see our hospitals be threatened, as we see our schools have more risk conveying into them, there are potentially more dramatic steps that have to be taken. The governor of Utah has done a massive shutdown in Utah. The governor of Ohio yesterday started putting in new restrictions. El Paso has had to have the Air Force medical personnel flown in because their healthcare personnel were unable to staff the emergency field hospital. If we start to see those things, and that's the path that we're on with the upward trend and escalating number of infections, dramatic steps will have to be taken, and we don't want to put our economy, our social structures back into threat. But this is real, and everyone needs to redouble your efforts to avoid exposure at every chance you have.
So for the most part, the governor and the state strategy has been to keep asking people to follow these guidelines, to wear a mask, to safely distance, to wash your hands. Some of the things that you mentioned right here, these are the things that the governor and state health officials continue to stress. But we are still seeing this thing grow. We are still seeing this coronavirus spread at really alarming rates across all communities across the state. At what point do we get to this definition of insanity where you do the same thing over and over and over again and you still get the same result? When do we pivot to a different strategy?
Well, I think as the governor said, hospitalizations and deaths are lagging indicators. They happen late. The numbers of new infections that we're seeing this week, where we were over 1,000 almost every day and approaching 2,000, those are a grave cause for concern. And every local leader and every state leader should consider what they can do. The governor has some steps. I think he's going to be forced to move forward on some of those in the not too distant future, unless we break the exponential increase in number of new cases that we're having.
And again, what would those steps that the governor might have to take be?
I think we see other governors doing local lockdowns, not necessarily statewide shutdowns, but where there is a hot spot, having local suspension of activities, giving local mayors more authority to do enforcement of curfews or other efforts to get masking up. Our business community has a role to play. Every business should actually have their customers and their employees masked at all times if they have close contact or they're in a public space, or those businesses should lose the protection for COVID protections legally that the governor has extended. There are a number of things to do to ramp up, and I think increasingly it's going to have to be an enforcement action to have that be successful.